Welcome back to Winning Isn't Easy, Breast Cancer and Its Symptoms. Now, the Cleveland Clinic of Florida estimates that breast cancer affects over 200,000 women each year in the United States. And while it's more common in women, men can also have breast cancer. The type, location, and spread of cancer are all going to play a role in how it's treated and whether ultimately it might become disabling. Treatments often include radiation therapy, chemotherapy, hormone therapy, targeted biological agents, surgery, or a combination of all of these approaches. The goal, obviously, is to stop the cancer growth, prevent its spread, and to improve survival rates. But we know that the process is grueling. So I want to start out by talking about the 6 stages of breast cancer and how disability carriers or plans may view the claim based on the staging. Now, while not every stage is immediately disabling, the stage of the cancer diagnosis often dictates the treatment plan and the recovery timeline. And I think that knowing the differences can help explain why some people can't work for months or even years. So stage 0, cancer cells are inside the breast duct. There's no invasion into the surrounding tissues. This stage is often referred to as ductal carcinoma in situ, DCIS. While the progress is excellent, treatment can still involve surgery and radiation, which can have lasting side effects. And it's the surgery and the radiation which potentially will give rise to a long-term disability claim. Stage 1 is tumor size. It's under 2 cms and is confined to the breast. Now, this may require a lumpectomy or a mastectomy, often followed by radiation or chemotherapy to ensure that no microscopic disease remains. Stage 2A is where there is no tumor that's found but in the breast itself, but the cancer cells are detected in axillary lymph nodes, basically under your arms. Surgery plus systematic treatment are often necessary, and I find that there are many complications that can result in a disability claim as a result of treatment of the lymph nodes. Stage 2B, the cancer has reached the chest wall or the skin of the breast and has spread to the auxiliary lymph nodes. Recovery generally requires multiple surgeries, radiation, and extended chemotherapy cycles, again, giving rise potentially to a claim for disability benefits. Stage 2C is where the cancer is spread to the chest wall, the skin, the axillary nodes, and lymph nodes near the breastbone and the collarbone. This is considered to be a locally advanced disease and often requires aggressive treatment. And then stage 3, 4 is a different ballgame. And stage 3 indicates that there is an extensive spread to the regional lymph nodes or the chest structures. And stage 4 means that the cancer has metastasized to distant sites like bones, liver, lungs, or the brain. Now, these stages are typically disabling both from the disease itself, but from the ongoing effects of the treatment. Now we've established the basics. Let's talk about the common symptoms of breast cancer. And it's really important that you are documenting in your medical records the nature of your symptoms and how those symptoms impact on your functionality. We know that symptoms can vary from person to person. Some people will notice a physical change before the diagnosis. Others will discover the cancer only during routine screening without any signs or symptoms. But let's talk about the common signs and symptoms. First would be swelling or part of all of the breast, even without a distinct lump. Second is going to be skin irritation, redness, or dimpling that may resemble an orange peel. Next, pain or tenderness in the breast or nipple. Next, a lump in the breast or in the underarm area. Next, the nipple turning inward, which is called retraction, or a sudden change in its appearance. Red, dry, flaky, or thickened skin on the nipple or breast. Next, a nipple discharge that is not breast milk that's sometimes tinged with blood, or an enlarged lymph node under the arm or near the collarbone. So those are the basic symptoms. But now let's talk about why those symptoms matter in a long-term disability claim. From a long-term disability insurance standpoint, and even from a Social Security standpoint, the severity, frequency, and persistence of the symptoms should be documented. Even early stage cancer can be disabling if the treatment side effects cause pain, swelling, limited range of motion, all of which can impact your ability to perform not only key duties of your job, but key activities of daily living. In other words, swelling and tenderness in the chest or the underarm can make lifting, reaching, or even sitting at a desk difficult and painful. The dimpling of the skin or the skin thickening can seem cosmetic, but it can indicate deeper tissue involvement that can require aggressive treatment, can also impact or impede your range of motion. It is really important that you are documenting these symptoms, not only at your original visit, your initial visit with your provider, but at each subsequent visit. They're called interval visits. What happens is that we want to make sure that your medical records are documenting the symptoms, the nature of those symptoms, the frequency of those symptoms, how those symptoms impact your ability to function not only at work or at home, and to discuss if there are any side effects of treatment at that stage and how those side effects impact your ability to function not only at home, but at work. As you are preparing what I think you should be doing, a document for your doctor, giving them the interval history, I want you to think backwards. Think about this period of time between your visits and what's occurred to you, and give real life examples of the problems you are having at home or at work. It may be that you have problems with fatigue, problems with concentration, problems with swelling of your arms because of lymphedema, or difficulty using your arms or shoulders in front of you. Whatever the difficulty might be, you should also be explaining that to your doctor and give some good examples. I suggest that you give that document to your doctor and ask that it be made part of your record. But you need to keep a copy of that document because it will be used later in your long-term disability claim and potentially your Social Security disability claim. Got it? Let's take a quick break.